We're flying through 2025 and the NHS has rapidly changed its focus. With increasing attention on primary care alongside patients with increasing complexity, clinicians countrywide need to ensure their skills are up to scratch to ensure high quality patient care. Here are those 5 high yield skills that can help you upskill to be a more effective clinician. I'm Camille from Pareto Education and welcome to our YouTube channel. Be sure to like, subscribe and click that bell icon for more awesome content. Today we'll be discussing key areas of practice that primary care clinicians should upskill in to deliver that high quality, evidence-based patient care. That's why at Pareto Education we offer externally accredited CPD courses that do provide practical, high-yield learning for healthcare professionals. These courses can be accessed via our website, so be sure to check out the link in the description for more details. So let's dive into the key areas where primary care clinicians should focus their upskilling efforts. Firstly, understanding and filing investigations, whether that be bloods, ECGs or spirometry. Why is it important? Well, primary care providers are increasingly becoming diagnostic hubs, offering greater access to investigations in order to facilitate downstream referrals. This means that more blood tests, ECGs and spirometry results will be landing on your desks. Interpreting these results accurately is very important, and you should also put them into the correct clinical context. Conditions such as thyroid disorders, diabetes, atrial fibrillation, asthma, COPD and others are heavily reliant on these results. So here are some tips to improve your skills. You should develop the ability to recognize normal and abnormal values and when to refer a patient on. You should understand and appreciate a trend over time for a patient rather than relying on any singular result. You should be able to effectively communicate the results to your patient and ensure appropriate follow-up. If you are looking to refine your diagnostic skills, our CPD on-demand service should cover courses such as interpretation of blood results and eventually ECGs and spirometry. So head to our website for more information. Chronic disease management, whether it be asthma, diabetes, COPD or hypertension. Why is this so important? Well, with the rising burden of long-term conditions, clinicians should be confident in managing long-term chronic diseases to prevent those complications and improve quality of life for our patients. Practices get paid handsomely in the form of cough payments, and the managers will love you if you can assist them with their chronic disease burden. Some key areas of focus include asthma and COPD. You should help patients optimize their inhaler therapy, understand spirometry results, and recognize when and how to step up or down treatment. Diabetes, whether that's interpreting HbA1c results, managing complications, or personalizing the treatment based on the patient's individual needs. Hypertension clinic, ensuring accurate BP monitoring and understanding cardiovascular risk scoring and optimizing antihypertensive medications. Having an in-depth understanding of chronic disease pathways is crucial for improving patient outcomes and reducing hospital admissions. Palliative care, and why is it important? So with an aging population and an emphasis on end-of-life care in the community, primary care clinicians must be confident in managing palliative patients. We used to think of palliative care in the context of cancer, but we understand this is something much more broader. Services are stretched, which means the burden of disease management is falling on primary care. So here are some key skills to develop. Recognizing when a patient is transitioning to end-of-life care as opposed to active management. Managing their severe symptoms such as pain, breathlessness and nausea. Having those sensitive conversations with patients about advanced care planning, DNA CPR discussions, and supporting families through this tough time. Deprescribing in palliative care continues to be a vital exercise to ensure the comprehensive care. What medications does the patient no longer require? Upskilling in palliative care ensures dignity and comfort for our patients in their final stages of life. Another important element is antibiotic stewardship. So why is it important? Well, antimicrobial resistance is a growing public health phenomenon, especially in the UK and also around the world. Primary care is responsible for a significant proportion of antibiotic prescribing, so we're in a global battle against resistance and prescribing guidance is updated regularly. Again, practices are rewarded handsomely by government for good practice, so this is an extra bonus. So here are some key focus areas for your learning. Understanding when antibiotics are necessary and when they can be avoided. Choosing the correct antibiotic, the dose, the duration based on up-to-date guidelines. Educating your patient on the importance of completing courses and preventing misuse. Practicing responsible prescribing, which will reduce resistance and protect the effectiveness of antibiotics for future generations. And lastly, mental health in primary care. Why is this important? Well, mental health conditions such as depression, anxiety, and stress-related disorders are amongst the most common presented in primary care. The recent Darzi report quoted mental health as one of the largest contributors to economic inactivity. Services are overwhelmed and mental health presentations are increasingly complicated. Managing such patients with high risk in 10 to 15 minutes is tough work. Key skills to develop here are conducting effective mental health assessments and risk evaluations, initiating and managing first-line pharmacology and non-pharmacology treatments, knowing when to refer to specialist services and how to support our patients while they await secondary care input. With increasing mental health challenges post-pandemic, ensuring competency in this area is crucial and critical for patient care. So these are the key areas that we believe truly represent fundamental skills that every primary care clinician should continuously develop. And this is for the best possible interests and care for their patient. At Pareto Education, of course, we offer externally accredited CPD courses covering these topics and many more. These topics and modules provide an in-depth practical learning to help clinicians improve their clinical practice, and you can access them via our website, www.paretoeducation.co.uk. You can also check out the link in the description. Don't forget, before you leave this video, like, subscribe, and hit the bell icon for more content designed to support healthcare professionals. Thanks for watching, and we'll see you in the next video.